Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today I have found my way to a healthcare navigator business in included health. And who would I find there but their CEO, Owen Tripp? Owen, it's great to have you here.
Hi, Jess. Good to be back with you.
Oh my gosh, so we need a catch up because it has been a while. So the last time I spoke with you, Grand Rounds had just merged with Doctor on Demand, and then you had acquired Included Health. And literally, you were talking to me about going to market under the brand name Included Health for the entire mega company that you had formed here in virtual care and care navigation. And so I want to pick up the story right there because I think that this is like a very great point in the market right now where there's a lot of focus on not only virtual care and care delivery, but also health navigation. And I'm curious about how things have come together over there at Included Health and where you guys are at right now. Would you say that you're more of a care provider plus navigation services, or are you more of a navigator with some care delivery involved?
Haven't we been having this conversation for years? I think categories are tricky in this space, especially how fast not only we're moving, but frankly, the world around us is moving. And the reality is what our members ask us for is to take care of all of their problems, big and small, financial and clinical, and do it all included in one place. And that's really how we think of ourselves, as the platform and the care provider to make sure that they can get all those questions answered with all those insulting stops in the process, the go over there, check in at this desk, fill out another clipboard. That's sort of the really important part about how we go to market. We did announce with you that integration of those companies, and it's been a really busy couple of years. It's been an exhilarating couple of years. I want to tell you more about this, but the premise by which we made those moves, the idea that people would want more of that care integrated together, that they wanted to not only be navigated to a doctor with a friendly advocate who could provide expert guidance, but in fact, maybe actually see that doctor in one integrated experience. Boy, has that turned out to be the right thing. And we've been really busy on that. And we believe the market has actually shifted with us and around us to have that as a core expectation of what great navigation and great virtual care delivery looks like.
Cool. Well, I want to dig into this. So, I mean, right now it seems like everybody is getting into care delivery. I mean, we're seeing more retail health players get in there. It's like the rise of the payvider right now, where it's like all of these payers are starting to provide different levels of care delivery. And primary care is hot. You guys have been primary care forever. You've augmented with like urgent care, specialty care, behavioral health care. Tell me how you think you guys are differentiated as a virtual care clinic providing these services against some of these really big players.
Yeah. And it's, I mean, let's just celebrate the fact that the world has moved. I mean, the first time I met you, Jess, barely 10% of people had ever tried telemedicine, and most of them didn't indicate that they would want to use telemedicine again as a preferred access and form of access into the healthcare system. And now, thanks to sort of this pandemic that has been our reality for a couple of years, but the fact that the technology and the tools have also evolved, there's now a normative expectation that we can meet with our providers. We as patients can meet with our providers and have asynchronous and synchronous conversations. And yet nobody's really delivering it yet. And to the extent they are delivering it, they're living in these very siloed forms of care. This is my urgent care telehealth provider. This is my dermatology telehealth provider. This is literally, I got pitched on a company that is my cannabis delivery with medical needs telemedicine
Doesn't
company.
everybody have one of those? Oh, come on.
It had a great name too, by the way. I'm not gonna say it on video because I think they're still in a process, but I love the name of the company. And so the reality is that those things need to come together. And so I've been telling our clients and our team lately that telehealth as we knew it, telehealth 1.0, which was the sort of call a doc sort of experience of where you'd put a quarter in the jukebox, you'd hear one song, and then you'd move on. That is dying. And it may not even be really around as a standalone thing in the next couple of years. But integrated virtual care, where you bring together some of the pieces you just talked about, not only great everyday 24/7 urgent care, but primary care, where you stay with the same team and that team has access to all of your data, financial, clinical, otherwise. It's integrated with behavioral health. So the BH provider and the primary care provider are reading from the same score of music with the same care plan and your same guide points in mind, and bringing in not only specialists, but truly the experts at all of these institutions who might be writing the latest evidence-based protocols for care, and integrating all of that care into one common app for the member, yes, but also one common provider app. So the providers can work for the first time, probably ever in their careers, as a unified care delivery team. That's what's different. And that's what's changing really dramatically. And honestly, I don't think we can get the world changing fast enough around us.
To riff on your analogy a little bit, the jukebox one, and say like, okay, so this is now like the Spotify premium of telehealth experience where I can build my own playlist and everybody is able to access it if I share it. I love it. So tell me a little bit about how this integration is going, and maybe talk a little bit about some of the technology behind enabling the clinicians to have that one full look at the patient. And I'm digging in on this, Owen, because I want to talk a little bit about the navigation part of this, but I want to start here because I think that understanding, how you're getting a complete look at the patient and helping build that patient experience around that is really important. So say a little bit about some of the technology that's around that helps those clinicians work together.
I love that you're asking that question, because what I just described is unfortunately not an off-the-shelf technology. I would have loved to have gone out and bought the latest and greatest from some other software provider who had figured that out. But we're now getting to the core of what Included Health has to do on the research and development front. Let's just take one simple example. If I am a dermatology patient who also has a complex autoimmune condition, which may in fact be driving some of the needs on the dermatology side, there, I actually have to have those care plans fully available to the whole team with triggering events to the whole team at the same time. One common, think of it almost like a WhatsApp chat. So everybody can see the progress. They can post parts of the medical record. They can post things to the timeline of the patient. They can, using your Spotify analogy, share the care plan and recommendations to other members of the family. This has been a really cool innovation that we've developed out actually for the better part of a decade,
Like that.
so that more people are included in that form of care delivery. And that is, why our providers actually give us the NPS that they do when they say this is a great place to work, because I'm working in team-based medicine, not just labeled team-based medicine. It actually feels that way. It's very cool for them to be able to call out to an ENT who is an expert and bring them in on a case, or have a primary care doctor be able to pair with somebody who has, on the BH side, who has deep knowledge of the pharmaceutical needs of somebody who has bipolar disorder, and to be able to do that in a way that the patient feels it and connect to that. So you have to set up those triggering events. You have to set up the timeline that's available to the member. And of course, you have to ingest a lot of data and make sense of that data. So you're not asking your team to scrub through gallons and gallons of raw data in order to get to any real insight. And that also is a big part of what we've had to develop.
Say a little bit about the insight that you're gleaning from all of this data and all these interactions that are helping enable the navigation piece of this, because that I think is where the secret sauce kind of comes into play. In terms of, the market wants to be able to show that navigation helps reduce the cost of care. It helps get people to better health outcomes. So say a little bit about how these insights from the data are helping you guys do that, and maybe brag a little bit about some of those outcomes.
Well, I think let's just honor the question you're even asking, because so far, you and I were talking recently that we've been doing this for a while. And early on, digital health was really seen as a convenience play, just an alternative to the traditional delivery system. And that was necessary. So I don't mean to speak ill of the important foundational history we had. But really now, especially against this economy, it's time to say, where's the beef? What are we doing? And we really think about outcomes in two major buckets: the financial outcomes, which we can talk about in a second, but really we start with the member outcomes. What are those health outcomes you're moving, and how do you move them? And so you may see me looking down here a little bit, because I just want to make sure I get these right for you.
Get them right. It's okay.
77% increase across our all-included care patients. So these are the people who are using the product I'm describing, now millions of them, to higher quality primary care in their town that they are in, having a connected relationship with, or where there's no access to our own primary care team. Driving better adherence to screening across A1C, preventative screenings like colorectal cancers, breast cancers, 5, 10, 15% increases across those different areas. This is one of my favorites. 77% improvement in 1 year blood pressure for people who were considered at high risk or elevated risk for blood pressure. That's incredible.
Yeah,
right?
it's incredible. Heart disease, number one killer.
That's right. And a lot of this, my team's going to probably kill me for saying this. A lot of this is not like we discovered a new cure for these things. It's actually about using commonly available evidence-based interventions, but being able to do it at scale through a digital and phone-based, when necessary, interaction where the member's like, I'm going to go to this place and I know they're going to give me everything I need. And I actually often think that in healthcare, a lot of times it's not about having sort of wonderfully concocted new ideas. It's really about delivering through the things that we already know work. And we're really proud of our efforts there. And our team has been amazing in delivering that.
I love that, and I like that you haven't discovered the cure, but you've discovered a way to put the cure in front of a lot
More
of
people's
different
hands.
people
Yeah.
who could take advantage of it. All right, so go back for me on those cost savings outcomes. Don't
Yep.
think that you're gonna walk away from this interview without telling me a little bit about that, because it truly, on the navigation side, that's been the thing, right? Is that the navigator is supposed to help get people routed to the right place, so there's less waste, less wasted diagnostics, less wasted time, appointments, things like that, and then kind of help make sure that acuity is matched to the kind of care they're receiving. So tell me how that's netting out for you. And you guys, it merits saying, have a client base of a lot of employers, and you also work with health plans. So what can you tell us about how this is working out to impact the bottom lines for those folks?
Well, this is my brag moment, by the way, because not only do we have a diverse portfolio, like you mentioned, health plans and employers, we're working with all of the largest health plans in some form or fashion. We're working with at least 30%, over 30% of the Fortune 500 have one or more included health products. So the ability to reach and influence the agenda at these companies that are literally writing the standards for how care should be delivered has been awesome. And to grow with those clients and be able to devise a lot of what I'm telling you about today. But we did some announcements a couple months ago. So those of you who are watching and would like to go back and actually read those really juicy actuarial findings, we did 2 independent reports. So these were firms outside of our company, and we did 2. We thought it was important to do 2 to see how they came back. And each had findings that showed that cost reductions were in the 6% off of healthcare trend for the years that were studied, which I think were the last 3 years, on our core navigation platform. Now, that is an awesome finding, but really points to the fact that when we look at the healthcare cost problem in the United States, it's so inextricably linked with quality that simply by navigating members to higher quality care and getting them access to that care and taking them out of the sort of pinball experience of bouncing around trying to find a safe home, and we get them to an expert, empathetic, and trusting relationship, you actually are able to get to the more appropriate cost trend. And that obviously is going to be a key, not just as we look in the rearview mirror about the healthcare cost experience, but as we look forward to what everybody is picturing to be a much, much more difficult healthcare cost trend environment.
Yeah, let's talk about that for a second. What are you hearing from employers? Let's start there, because I mean, we are all in a very, obviously paying close attention to the difficult macroeconomic climate that we're in. And healthcare, obviously a huge expense for employers. They've been trying to save money there for a long time. I think, it's the screws are gonna get tightened even more here. But what are you hearing? Give us some gossip from either your client base or some of your prospects about what we can expect for healthcare spending moving forward through the back half of 2023 and into 2024. I know everybody's doing their budgets now, so it's like, what's going on, Owen? Tell us.
Yeah, this is the hot gossip. So
Tell us.
the reality is that most of the best employers and health plans in the country are really they've 23 is shipped, right? There's nothing much more they can do there, but they're thinking, and likely actually at this moment in time finalizing 24, and then they're thinking ahead to 25. And so I can tell you a few things, none of which is probably going to be particularly uplifting. Most of them are preparing for double-digit healthcare cost increases, and that exceeds even this very blazing, consumer price index inflation that we've been seeing, and you hear the Fed talking about constantly, right? So you've got a healthcare cost form of healthcare cost inflation that is predictably exceeding the rest of our inflationary metrics, indices. But the problem is that those companies, in order to catch up on their own businesses, are not going to be generating price increases to match, and that's a problem. And the real choices are going to be about how you play with that plan design to get people to a smaller set of options on where they go to get care. That's the only way that's really still available to large employers for managing cost change, because they've exhausted what they can do on the deductible side. They've exhausted what they can do on the copay side. So the reality is, I think you're going to see tighter networks, more closely managed. I do think the ray of light, if there is one, is that there is a real awareness that member experience and consumer experience really matters. And that if you put the consumer in the driver's seat of that, then actually you're going to get to better outcomes. And that's certainly something we believe at Included Health, that the members should be in charge, should have agency. And lo and behold, to be able to share the data like we have is really important.
All right, same sentiment among health plans. I don't want to lump those two groups together because they have very different strategies, right? So what are you seeing in health plans? I know you guys work with a large number of those as well. Are they, I mean, I feel like they're always very mindful of their bottom line, but I mean, what have you noticed is changing maybe in the way that they're approaching, 23, 24, 25?
Yeah, I think it's a really interesting time in plan design, and I'm sorry, in health plans. In fact, I'm very optimistic about some of the innovation and the conversations that are coming out of the health plans broadly. I wouldn't say this is true in every single shop in the United States, but a number of them have recognized that they have a role to play, not just in the underwriting and pricing of these health plans, but in thinking through the delivery options that are available. And that it really, at the end of the day, is going to be about finding an alternative to the very expensive traditional fixed cost form of delivery. And this too is where virtual becomes really, really important. So I'm optimistic that the health plans play a larger role in going to employers and other constituents and saying, we can offer you a better member experience at a lower cost of delivery. And this is what it's going to have to look like. So I've been around the country. I've been doing those meetings lately. I think I've met with 5 CEOs of the largest health plans just in the last couple of weeks. And that's the conversation I'm starting to hear. Real awareness as to what this ought to look like, and an openness, again, not everywhere, but an openness in many quarters to forms of partnership that allow them to reset their cost basis.
Are they more interested in the value-based design than we've seen them be, in your opinion? I mean, even the value-based design light, which I feel like is very much the in vogue thing to have right now, where it's not a full bore, value-based care model, but it's there are parts of it that are and parts of it that are not. What are you saying?
Yeah, I mean, it's interesting. We could take so much time on this. I mean, and for anybody who happens to be tuning in, sort of worth mentioning that Included Health is largely focused on, the working families of America. So we're in commercial, and we partner through health plans, and we do our own work there, and we support our nation's military as well as federal government employees, state government employees, et cetera. But oftentimes the value-based care arguments start and end in Medicare and Medicaid, and there are sort of very good and well-developed models to make that work. I am cautiously optimistic that in commercial, those models are also starting to, take hold. In fact, if I can sort of throw a prediction out to future Jess and Owen, it would be that in a couple years, we're actually talking about some real demonstration of very different ways to price care delivery in the commercial market without having to have a fully insured, product, right? It could have flexibility like what the self-insured have enjoyed these last few years, but more predictability associated with their cost trend. I do think that's coming. And I do think that the health plans are starting to get that. It becomes just a question of actually how you price that, given the tenure and complexity of these employees.
All right, now I'm going to pivot to some fun things because I want to get your take on some hot topics in what's happening in healthcare writ large here. Well, one of them is fun, one of them is not so fun. The more fun one, I think, is GLP-1s. I mean, so where are you guys at in terms of prescribing these weight loss drugs? I mean, this has been the topic of conversation, it seems like, for the past few months. I mean, these drugs help people lose a great amount of weight very quickly, but they're also incredibly expensive. So from your vantage point, navigating, working in a primary care kind of environment and working on behalf of plans and employers to help reduce costs, I mean, where do you guys find yourself? What's your stance on the GLP-1 debate?
Yeah. So, by the way, only in our line of work are GLP-1s a super fun form of conversation. But you are right that for a very large number of patients in this country and potential patients, these are incredibly effective drugs. At least they seem to be incredibly effective drugs on pure weight loss. And let's not lose sight of the fact that they started as a class of diabetes medications and obesity-related complication medicines, and they're very effective in those domains as well. The thing to be mindful of is that there's a whole conversation, or maybe two conversations, I don't think have really started. One, which is most of us recognize that once you start, you have to stay on these things. And they have to be wrapped in a whole bunch of other care management and symptom management that I frankly think most of the prescribing doctors are not well prepared to actually do. So we think we have a role in that. And then second, that the affordability of this intervention relative to all the other interventions is something that any employer or health plan needs to think about what they're willing to sign up for, because once you sign up for it, you're sort of on it the whole time. See point number one. So those are the two big considerations. Put sort of very simply, what Included Health is doing is, and has been doing, so this is not new for us, we've been in this game for years, where we do prescribe these medications as part of a total health plan. We're not doing it, at least not right now, as a carve out on behalf of employers, because our whole point of view is that this has to be managed holistically on behalf of the member. And we have to think about this as a way to both address underlying needs for that member, but also in concert with employers. And Jess, the data, 40% of employers have already come out, made it clear they're not going to cover this. About the same percentage or roughly the same percentage is not sure yet. And I think more of those are going to move into the we're not going to cover it category, which is going to leave patients in a little bit of a bind.
Yeah, I agree with you on that. I think moving forward, we're going to see a lot more restrictions in place on who can take those. And I mean, I think rightfully so, to your point, especially when it comes to comorbid conditions that could exist around somebody being obese. Okay, this is the unfun topic. And it was interesting, Owen, because I'm thinking about what I wanted to ask you, and I'm thinking back to Included Health's roots. So like the tiny company that, was acquired by the Grand Rounds Doctor on Demand business, when you guys acquired it, it was really focused on providing healthcare to the LGBTQ plus crowd of patients. And so I thought to myself, I'm like, they've got to have an opinion about what's going on with all of the rights that are changing or even being called into question around care for these populations. I know you have passionate people on your team that are writing about this, even on your own blog. So, I mean, talk to me. How are you guys thinking about this? I mean, what's your stance as Included Health in terms of what's happening with some of these rights and the politicization of, LGBTQ plus healthcare?
Yeah, so you can imagine. So you're absolutely right. That was the product number one of the original Included Health. We now have turned that into communities inside of the new Included Health. And communities is a big part of our identity and our philosophy for how we think about care must be more equitable. And I'll just sort of mention, Jess, that since we talked, I'll come back to the core of your question, but since we talked, we introduced our second community. This was built for the Black community. And there, we're looking for culturally concordant care, affirming care. We're looking to reach into populations that have historically experienced bias or lack of accessibility in all forms of care. And one just cool statistic there is 35% increase in usage of behavioral health services for the members of those communities and in zip codes that are largely African American and Black communities across the United States in our population.
On that. That's a great stat.
Great stat. And something, by the way, that is like, if people ask me, why do you sort of do this? I've been doing it over a decade now. Like, that is my spring out of bed moment when we can do that sort of stuff, because we can have that sort of impact. Now, the core of your question is really a political one. I think it's sort of, why has the conversation become so tilted and so nasty around who should have access to certain forms of care? And Included Health, the bottom line is that we follow evidence-based medicine. And we have work with, employ, partner with truly spectacular clinicians around the country. They all sign up for that too. They take an oath to take care of people. And the evidence here is clear, not just in LGBTQ plus, but in reproductive rights generally. And where things are legal to prescribe and treat, we are doing that. Where it is not legal but evidence-based, we are trying to work with our employers and other partners to make accommodation for those employees. And we've done some really cool travel programs, and we'll continue to do that to power the form of care that those people need. I'm sort of dismayed at the tone of the conversation in this country, but I'm also grateful to my colleagues to making sure that everybody gets what they need.
All right, good. Good to hear that you guys are trying to figure out how to make things work so that those populations can get the care that they deserve and need.
Yeah.
All right, what's next for Included? I've got to know, because I am like thinking, like sitting here right now, I'm like, oh my God, what are they going to do next? I mean, you were acquisitive, a couple of years ago when we first spoke, and then the rebrand happened of Included Health. And now it's like, what direction do you go? I mean, do you double down on the virtual care side? Do you, take the pivot that some of the other navigator businesses in the market have taken, like either Right Way or Transcarent, starting to go more PBM, starting to look at building your own Or do you go into like more of the care delivery strategy that some of these other virtual first players have that have been like getting a lot of attention, a lot of money lately, like the Carbon Health or the Village MD or the One Medical that has an in-person presence to go with their virtual care clinic? So Owen, what do you got for us, man? What's on the roadmap? I want to hear.
Well, I think all of those things are interesting, but the best way to predict anything Included Health is going to do is sort of ask yourself as a member in the system, what would you want your care to look like? And it's really that simple. I mean, this gave us all the conviction we needed to bring navigation and virtual care together because people wanted that together. And man, like peanut butter and jelly, they're like, I can't forget that. That is delicious. That is now my expectation. I share with people, by the way, that well, it is classic and it works. And all of the RFP volume, so this is sort of the top of our new business funnel on navigation, has shifted to say, how do you bring navigation and virtual care together? That was not a question that existed 2 years ago before we did this. So we do want to move the market, but we always want to move it towards what the member expectation of great care is. And I'll tell you a couple of things I'm thinking about.
Please.
One is we're still too fragmented. So virtual is great. But like I said, telehealth, pure standalone transactional care, not only is going to die, it needs to die. It's too isolating. It's not connected to the rest of the experience. So we're investing a lot. We've made some announcements already. You've seen them, Jess, around the intersection between in-person care and virtual care. And imagining what it would look like to have the world's greatest primary care team in your pocket, with the ability to put you into any situation around the country that you needed to be in, whether it's routine labs or it's an in-person experience that complements that virtual experience. And so we're hard at work thinking about what that looks like. We've made a couple of announcements. We've got more coming in that space because we really do think that that needs to be brought tightly together. We're also thinking about how digital health standalone solutions need to be brought together. Because right now, they exist sort of in this constellation twinkling, but they don't really connect with each other in a way that's meaningful, and it leaves the patient in the lurch trying to figure out where to go next. And the last thing, it's sort of the driest topic, but I think it's ultimately going to be the most important for how any of this innovation lasts, is how do you price it? You know, you asked me about outcomes. Those outcomes that I shared are healthy day metrics. These are some of the most important things to me, to my colleagues, about knowing we're doing the right thing. We've got to connect those metrics all the way through to a pricing model that's going to work in our market. And I don't think people have really figured that out yet. So that's another area that we're thinking about.
That's very interesting. And it makes me think of what's been happening lately at Amazon with One Medical and now being able to reach a whole bunch of Prime members. So pricing, I think, is going to be the next. And that's honestly, you say that's dry, but I think that's one of the more exciting topics. I love payment model innovation. Always have. I'm a health plan girl from the beginning. So I like to see how some of our... Go ahead.
What you pay for is what people do. That's why you're smart. You like it because you know that actually is what drives all the behavior. And we do need to think about it, but I don't think we should rush into something that's not going to work either.
We shouldn't rush in, but we could definitely be a little more creative than we have
been. Move towards it.
All right, Owen. Well, thank you so much for stopping by. I encourage you to, to explore that curiosity on the payment model design and get creative over there at Included Health, among all of the other wonderful things that you guys are doing. It's exciting to hear how the three separate companies have really, merged together, and to see the care infrastructure that you've built around the patient, and also to really support the clinicians. That's an exciting thing to hear, that your clinicians are really, giving you such high NPS scores for their experience working across the board. I like to hear about clinicians not being so burnt out and stressed out. So it's good to hear that you guys have them in mind. All right. Well, thank you so much for joining us here again. For more interviews with those who are changing the way that we do healthcare, like Mr. Owen Tripp over there, head on over to my YouTube channel. It's youtube.com/WTF Health. I'm Jessica DeMassa. That was Owen Tripp, CEO of Included Health. We'll talk to you guys again real soon. Take care. Bye.